Hi guys, welcome back to the channel. I'm sat here again today with the oculoplastic surgeons from Face Restoration. We've got Rachna and Jonathan. And today we are going to be talking all about lid lifts.
As we age, again, I hate to be the one who talks about aging because I'm already grey, but when you, as we age, some of us notice that our lids start feeling either heavy or that they're affecting our vision or that they just make us look more sleepy. Is this just saggy skin? Or is your lid actually low? And the best way to check that is to look at your pupil. You can look in the mirror and your pupil should not be covered by the margin of the lid. That would tend to suggest that you have something called a ptosis, which is where the lid itself is low. And that tends to happen either with age or with certain medical problems. And so it's important to investigate those. But the most common thing that happens is the skin gets saggy. And so even though the lid is in the right position, you get skin above that starts hanging down on top of that lid margin.
Really wish that I had a mirror right now because I need to check myself out. Yeah.
Which is why I was looking right at the camera just then, so you can see where my pupil was sitting because mine is slightly wonky. But slightly wonky, yes. So I mean, we all have a bit of asymmetry. Not all of us. Some people are perfect, but most of us have a bit of asymmetry. And I think most of us will have a degree of a slightly lower eyelid on one side compared to the other.
If your muscle here that normally lifts the eyebrows drops down, it can make it look like you have this extra skin. And the danger is if you remove the skin and then it turns out that actually it was your eyebrows, and once you have your eyebrows lifted, you won't be able to close your eyes anymore. There are lots of things to think about. You've got to think about the eyebrows, you've got to think about the actual lid movement, and you've got to think about the skin and whether the eyes are dry. What sometimes happens is that you'll have a person who wants a rejuvenation. They feel like they're starting to look a bit tired, and so they go in and they have a procedure. And if you do too much and remove too much fat or too much skin, you can actually, because this is such an important area for identifying who we are, you can actually end up completely changing your appearance and you can become unrecognizable. And that's happened to a few very famous Hollywood actresses who've had very good surgery, but it's made them look like someone else. And
Are you going to say it?
no. Are you going to say it?
Shall I say it?
You say it.
Are you talking about Renee Zellweger?
Well, maybe. We're just going to go a little bit boring sciencey for a second, but in the 1960s there was this famous Russian scientist, and he did something called gaze tracking studies. So basically he put a camera up and looked at where we look, and when we first meet, the first thing we do is we look at the eyes and we go backwards, forwards, backwards, forwards. Then we go down to the mouth because that tells us a bit about the expression. Is it a smile? Is it a snarl? And then we go back up to the eyes because we get so much information about, are you interested? Are you tired? Are you bored? Are you paying attention? Am I talking too much?
Yes.
Am I talking too fast? All those things you will signal with your eyes. Then I'll also look around a little bit just to get a general feel. I might look down at your hands to see if you're brandishing a weapon, and then I'll go back up to the eyes. And so as humans, we are constantly communicating with our eyes. And if you're not careful with surgery in this area, you can send the wrong message. You can look you can look starey, you can look scary, you can look angry. And it's the same with the Botox treatments or the neurotoxin treatments that you might use. You don't want to lose your identity when you have surgery. You want to be you, just a more restored version of you.
We often combine the brow and the lid surgery. So when we do surgery, we would consider lifting the lid and considering lifting the brow as well, which is something called an extended blepharoplasty. There is a muscle that opens and closes our eyelid. So every time we blink and close our eyes, we use a muscle underneath called the levator muscle, and that's the one that can be weak and cause the lid to drop down. So when we want to do a lid lifting procedure that involves the muscle, we usually make a little cut where our natural crease is so that there is no visible scar at the end of it. So the opening is in our skin crease. We find the muscle underneath and we tighten that muscle.
It's better when you're having lid surgery to be awake, because then we can make sure that you're going to end up with lids that are in the right position for you. So that was the anterior approach to this thing called ptosis surgery or lid surgery. But you can also go in from behind, because as it turns out, there are actually two muscles, getting a bit sciencey again, but there are two muscles that lift the lid. And one of them is excitingly under voluntary control, so I can, lift the lid, or if I want to look up, for example. And there's one under involuntary control, which is the one that if you get scared or frightened, it's under a nervous control that you can't control, and your eyes will open up because the second muscle, which you can't control, acts with under the influence of adrenaline, noradrenaline. And that's also why there are certain topical treatments. So if you don't want to have surgery, you can actually put some pharmacological drops, something called alpha agonists, in the eye. And that will diffuse onto that muscle and stimulate it, and it'll raise your eyelid just about a millimeter and a half. And if you've got a little bit of asymmetry, that might be all you want for a night out. The problem is that sometimes it can also cause the pupil to dilate on one side compared to the other. So,
and it can make your eye very red as well.
In long-term use. But basically putting these, so that there are pharmacological options. I think we had one of the questions come through saying that could you use something like timolol, which is a beta blocker, to raise the lid? And that's not quite right, because that actually blocks that system. What we're talking about now is something called an alpha agonist. So rather than being a beta blocker, it's an alpha agonist. But that is another way of raising the lid. But it's not a long-term solution. It's just a...
So your audience might know about these drops because sometimes they are used if, for instance, Botox that has strayed a little bit too far away from where it should have been given causes the eyelid to drop down, and then you can use the alpha agonist to actually lift the lid up as part of the treatment before the Botox wears off. But it's not something that you want in the long term.
It also affects the pressure inside the eye. These are actually glaucoma medications, so pressure inside the eye problem medications. So it's not something we would say, oh, use this instead. This is very safe, standard surgery that we do all the time.
I love the idea of using something like just a drop just before you go out if you want to make your eyelids more symmetrical.
There are lots of... So this is exciting perhaps, but the Roman women 2,000 years ago were already onto you, Sarah, because there's a plant called the belladonna, and the belladonna plant contains a substance called atropine, and atropine actually dilates the pupil. And so what they used to do when they went down to their parties is they'd put a drop in, so they'd get these large, amazing looking pupils and these dark, seductive eyes, and they would look like beautiful women, belladonna, and that's why the plant where this drug comes from is called the belladonna, the deadly nightshade.
But it does mean that their vision's very blurry, so everyone looks gorgeous and handsome, so that's even better, right?
Beer goggles without the beer.
Yeah, exactly.
I love that.
The thing to stress to your viewers is that this is such a sensitive area, and it takes so little to change the sort of the fine balance of keeping the eye not too dry and not too wet. And I think in the break before, we were doing a little experiment which you might want to try at home, which is if you just stop blinking and really open your eyes for a bit, just as much as you can, and just keep them open. It only takes me about 10 seconds, and then they already start feeling a bit irritated, and I start getting slightly red eyes, and they start watering.
This is the competition we used to have as kids, but
and
I used to always win.
So who cannot blink the longest? But actually, if you open your eyes a bit so that things start evaporating a bit faster, then you'll find that even that slight extra opening is enough to trigger your eye to say, oh, something's not quite right, I need protection, and your eye will start watering. And that's so important to beware, because if you get things wrong around the eyes by even just a millimeter, that can really affect your quality of life.
We joke about it, but when we are operating on this area, it's a very, very good operation. And the downtime is actually not as bad as people think. So people think that they're going to walk out after a blepharoplasty operation for the upper lids with these huge bruises, and they can't.
I mean, the patient we saw this morning thought that she was going to end up looking like a panda, and that just isn't the case. And it has this unique ability to really make you look younger. So what some of the fillers and the non-surgical treatments can't do is get rid of the excess skin. And so that's something where surgery still, because it's such an easy operation, so straightforward, so predictable, and so safe, it means that you can, for not much risk, you can get a very much younger appearance. So sometimes when we're removing the excess skin of the eyelid, we can actually tunnel up and actually lift the eyebrow as well from the inside, and we can do a small eyebrow lift. And sometimes that's helpful, because what can happen is that it's not the extra skin. It's not that you have too much skin here, but that the eyebrow has actually moved down, and so it looks like too much skin. And so putting the eyebrow back in the right place, in men you don't want to lift it too much, because it can again, you can get a startled look. men should usually have their eyebrows sort of on the bone right here, the eye bone, as we've decided to call it. But there are some other ways as well. And so one thing we can do is an endoscopic brow lift. Now this is a much bigger operation, and it's a lot bloodier and it's riskier. And you actually make incisions here on the side and here at the top, and you tunnel down along the bone, and then attach the eyebrow to the periosteum, so to the lining of the bone. And that sounds like it's a big operation. It takes some time, general anesthetic, quite a lot of bruising. There are risks to the function of the muscles afterwards, and disappointingly, it doesn't tend to work that long. So it's not an operation I would have, because you're investing a lot of money and time and risk, and sometimes the rewards don't follow. So it might work for a year or two, and then you're right back where you were.
When I was training over 10 years ago, before I was a consultant, then at that time, most of the plastic surgeons that I work with were doing endobrows. And more we're finding that actually the longevity of that procedure doesn't really warrant the amount of downtime for that particular procedure. And you can get really good results with approaching the brow from a skin crease. So your scar is just here. You're not affecting all of the nerves in this area. You're not affecting your hairline. And you are maybe 2 weeks of downtime, as opposed to a few days with the blepharoplasty alone. But an extended blepharoplasty can improve the position of the brow as much as an endobrow very often. So it's finding the right treatments for the right person.
The third one is called a direct brow lift, and that's where you actually remove an ellipse of skin, which involves a little bit of the hair, so that you then end up with a scar that's semi-hidden by the eyebrow. That works well in people with particularly bushy eyebrows, and particularly in older people who might have more wrinkles, for instance, then that scar is well hidden. So it's actually, even though it sounds like, well, why would I want to have surgery directly on the eyebrow if I can, hide it in a crease? Often in older people, it is actually a very good procedure, and one that we like to do because it is very predictable, it lasts forever, and it's again very safe. Particularly in women, and often even in younger women, you can have there's one condition which we should just be mindful of when we're operating in this area, and it's called thyroid eye disease. People who have, you don't have to have a disorder with the thyroid, but if you do, you're more likely to have this. And it's where you notice that the eyes either get red, uncomfortable, or you get extra puffiness just in here because the fat around the eye is becoming more voluminous, more fluffy. And so when you see someone who previously hasn't had a problem with their periocular area, and suddenly things have changed, or it's important to just keep at the back of your mind, could this be something else? Could this be a disease process?
There is one thing that I want to ask. Gigi Hadid, what's she done?
The fox eye look and lifting the outer brow, and a lot of people have been doing that with the way they pluck their brows and the way they use their brow makeup. And it's something that lots of people want to emulate because it gives a sort of feline or a fox-like look and a higher outer corner of the eye. So I don't know whether Gigi Hadid has had any surgery for this. I don't know personally who she's been to see for the treatment, but it is something that a lot of people are interested in.
I think she's had a brow lift, looking at what's going on there. Is there any way to achieve that result non-surgically?
Well, as you would know, using your neurotoxins, you can get a lot of lifting of the eyebrow by paralyzing the muscle that squeezes the eye shut. And sometimes that's desirable and sometimes that's not desirable. Some of us might want that elevated looks. Other people might find that makes you look intimidating, what we used to call the Mephisto mask. And so, you can lift a lot with toxin.
Yeah. It works well with toxin, and she would have had toxin as well, I would suggest, because one of the things that happens when we do a brow lift is that we're not working on paralysing the muscles or weakening the muscles. So if you want a combination of lifting the brow, but also not changing the position of the brow and not bringing the brow down every time you make an expression, then you have to use toxin. So I think there's a combination of things there. We can speculate that there's been a brow lift and some toxin going on there.
Speculate.